So they tend to downplay, diet and
Yeah.
so-called natural hormonal things. And the reason is that there's not a lot of research that's been done. And this is where it needs to be done so that we can find how best to manage this.
Yes.
There is a researcher in the States by the name of Dr. Neil Barnard,
Yes.
who has done a lot of research on many different aspects, on cholesterol, heart disease, diabetes, and so on. But he's also been doing some research on hormone replacement
Yes.
and hormonal problems.
Yes.
And he's written a book called
in Body Imbalance.
Yes, the Body Imbalance, which is available. One can get hold of it in South Africa as well from various online sources. So that is quite helpful. And it certainly is looking at other women's conditions like endometriosis and adenomyosis and heavy periods and so on. So even things like acne can be affected by our lifestyle too. So there's a lot that can improve with women's health if we are getting enough exercise and getting enough sleep at night time and also eating correctly.
Okay, so basically what you're saying is, of course, we still have a room for treatment.
Yes.
I mean, and also I think, for example, also depends on the symptoms. If you have a woman who's the main problem probably have a drying of vagina and other things, rather than giving systemic, treatment, you can even give just a local, the lubricant that can actually assist. But having said that, also you're saying that if people can actually change their lifestyle and trying to eat, anti-inflammatory type of, diet and of lifestyle, such as lifestyle exercising can be anti-inflammatory.
Yes.
Eating food that are more high in, less in animal saturated fats and more fruit, vegetables and legumes, they can actually, their symptoms can actually get better.
Absolutely.
Definitely, yeah. And so now when we come to this lifestyle change, I don't know, the women that you interacted with, is it difficult? How do they come along with a lifestyle change? Because often, like you said, while we don't have much research, we have ample evidence how this can work. But when it comes to practically do those things, do you find women are equipped or to deal with?
Well, I think this concept, lifestyle medicine in terms of general health, chronic non-communicable diseases, is very well established these days. But I don't think there's enough research that's been done on women's health and the role of lifestyle medicine in dealing with those. I retired about 2 years ago, and it was only since I retired, actually, that I discovered the role of diet and exercise in dealing with women's issues. So although I spoke often to our patients about the role of dealing with things like diabetes and hypertension, high blood pressure, and lifestyle factors, I didn't often speak to my women who were going through menopause because I didn't know about it at that stage. So it's something that is fairly recent and new. And I'm sure there needs to be a lot more research done on this.
Definitely. Now, when I was it's more curious looking at this period of menopause. What does men go through that it can be similar to menopause?
Well, I think part of the problems of menopause is what takes place in a woman's social life at that stage in life. So, for instance, very often at that stage, her children have left home. There's this condition called empty nest syndrome, where she wonders what is her purpose in life, because she's not having to rush around looking after the children anymore. And this comes on to another aspect which you had talked about, and the role. Why is it that in animals, menopause is associated with mortality? In other words, most animals, when they reach the end of their reproductive career, they die. Except for two animals, and that is whales, and there's two kinds. There's the killer whale and the I think it's the right whale is another type of,
I didn't know.
Or pilot whale. Both of these whales have menopause. In other words, they stop becoming reproductive, but they still continue living for some time after that. And I think this is a divine creative genius for women to live still long after they are able to produce children. Because women still have a very important role in giving guidance to their daughters and also to their sons, although the daughters-in-law don't usually like advice from their mothers-in-law. But, also to provide for the grandchildren. I mean, there's nothing. My wife is a grandmother 4 times over, and she says her relationship between herself and her grandchildren is very different, and also, if not as intense, more intense than between herself and her children. And grandchildren need to have that guidance and that love and that support from grandparents. So this is why I think in humans, because we have eternity to think about, and because we are responsible people in this world, it's so important to have mature, wise grandmothers around to provide that guidance. Yeah.
No, definitely. So it's amazing that you mentioned actually that a few animals actually that go through that, and I think there is a plan. That's where often I defer to say that actually we coming from animals. Like some people, they're trying to see this issue of menopause, and they will think that we were not meant to live that long. Maybe now we overlive where we're supposed to live. That's why we're having all these problems. It's a penalty of living longer.
Yes.
But when you look at the biblical records, I mean, you have Abraham living to 900 something, and you have even after sin, everything continue going down, but you still having people living way longer. So I think I agree, concur with you that there's a purpose having that because that wisdom that of our parents for their grandkids, but also for their children as well. And not only that, in society, economy continue to run somehow with that wisdom that invested in older people. So I think there is a specific purpose.
Yeah.